It's my great privilege that we have Dr. Kimberly Thomas from Washington University. Fantastic to have her volunteering to spend some time with us today. Expert in immunology and also infectious disease. You see some of her qualifications there, which are fantastic, obviously. Postdoc at UCLA, postdoc at WashU, senior scientist at WashU, and on the research track as an instructor, Department of Pediatrics at WashU. PhD from University of Alabama. Fantastic to have her with us today and over 20 peer-reviewed publications in the field of immunology. She's going to walk us through a briefing or myth busting to help us all understand the vaccines, the mRNA vaccines, because this is something that, number one, all of us individually should understand, but also we know we get a lot of questions from our team members about this. And we want to help all of you to be able to understand better, but also explain better and help bust some of those myths. So I'm going to turn it over to Dr. Thomas to walk us through her presentation. Again, huge appreciation, Dr. Thomas, for all the time that you invested in preparing for this session and spending time with us this afternoon. Thank you.
Thank you so much for having me here. I'm really honored and excited to be here to speak with you today about the SARS-CoV-2 COVID-19 mRNA vaccines. And just a quick note, although I am an employee of WashU, today I'm not officially here on behalf of them, but rather on behalf of the scientific community at large and as a resident of the state of Missouri. So I'm hoping today's talk really helps alleviate some of the unknowns and anxiety surrounding these vaccines. And on a personal note, my family and friends have been calling me throughout this pandemic, trying to help them better understand everything they hear on the news and answer all the questions they have about COVID-19, vaccines included. So my objectives today are to communicate that these COVID-19 mRNA vaccines are highly safe and effective, have minimal potential side effects, and are really crucial for getting society back to quote unquote normal function. And as I was putting together this talk, it seemed to me that maybe the best way for us to learn about the vaccines was perhaps to deconstruct a lot of the myths surrounding them one by one. So I went out and looked up some of the top myths or untruths that were surrounding these vaccines, and I'm hoping that together we can go through them. And if you have any questions, please at any time let me know, and I'll be happy to take them. So the first myth that I found that was really disconcerting is that these vaccines will give you COVID-19, but the vaccine isn't actually capable of doing that, and this is why. So to get sick with COVID-19, you need to be infected by this fully intact SARS-CoV-2 virus containing all of its parts, its genetic material. Let me put my pointer on. Can you see this? The genetic material within the virus and also the spike proteins on the surrounding outside portion of the virus. However, these messenger ribonucleic acid or mRNA vaccines only contain 4 ingredients. They contain messenger RNA or mRNA, lipids, salts, and sugars. The mRNA encodes for the spike protein, which is what your immune system sees first and responds to. And then the salts and sugars are located inside this carrier to help stabilize the mRNA until it gets into your cells. And then lastly, this lipid carrier, which surrounds the mRNA and salts and sugars, and this helps the vaccine get taken up by your cells. So the vaccines can't give you COVID-19 because they physically do not have all the materials required to be infectious. They're just a copy of one piece of the virus. Another myth is that these vaccines contain aborted fetal cells, but I just showed you that these vaccines contain 4 types of materials. Both the Pfizer and the Moderna vaccines contain mRNA, lipids, salts, and sugar. And these ingredients are listed on the vaccine packaging, so you can read exactly what's in the vaccines. No aborted fetal cells. So the next myth is that the vaccine will change your DNA. And to be honest, I had a long talk with my brother on this one, actually. But this can't happen for a few reasons. So I'm going to walk through them. First, the vaccine gets taken up. Sorry, my pointer is in the way. Are you going to go up? There you go. The vaccine gets taken up by your cell, mediated by that lipid carrier surrounding the vaccine. And then the mRNA is revealed and it's immediately processed and it's processed into those spike proteins that it codes for. And these spike proteins are secreted by your cells and then found by your immune system, which then goes along and makes that immune memory to protect you from disease. So after the mRNA is processed into these proteins, it actually gets sent to your cell's trash compactor, essentially, and it's degraded. So it's not hanging around for a long time. And then your DNA, your genes, they're located over here in your nucleus on the other part of your cell, and they're surrounded by a nuclear membrane. And the RNA actually can't get through your nuclear membrane and into your nucleus. So there's no way for the mRNA to physically get to your DNA or your genes. And then on top of that, DNA and RNA actually physically can't combine, kind of like oil and water. So these are the reasons why the vaccine can't change your DNA. It gets used up immediately and then degraded. It physically can't get to your DNA because it can't go through this membrane. And then it also can't mix with your DNA. They just physically don't interact. Another common misconception is that because the vaccines were ready so quickly compared to other vaccines that we may be familiar with, that corners must have been cut. And this is absolutely false. All vaccines go through the same developmental and regulatory processes, and these vaccines were no exception. And to top it all off, mRNA vaccine technology, even though we call them new vaccines, the technology has been around for a while. It's not brand new. It's been in existence. The ability to use mRNA as a vaccine was discovered in the early 1990s, but it was originally set aside because of low stability and efficacy. However, in the 2010s, scientists identified new technologies like that lipid carrier that I showed you earlier, which helps improve the efficacy of mRNA vaccines. Also, we've learned how to do science a lot better and a lot faster. So things move at a faster pace due to additional technologies you may have heard of, like next generation sequencing. And in fact, these mRNA technologies that have been around for the past 20 to 30 years, they've been being used as we're talking to develop vaccines for other diseases like Zika and rabies and influenza. There are already vaccines in the developmental process using this mRNA technology. So it's not as new as we might think. And so basically all of the tools for these vaccines that we're seeing, they're already around. They were just ready and waiting to be adapted to be used for SARS-CoV-2, COVID-19. Also, the entire vaccine development process was expedited, and that was for multiple reasons. So over here on the left, you can see a schematic of the vaccine development process. And the timelines for these processes are really dependent on three things: on the urgency or need for the vaccine, and then also on the funds available for vaccine development and production, and then also on the type of vaccine being produced. Some vaccines take longer to make than others. So this being a pandemic where the need is great and urgent, and that these are mRNA vaccines, a specific type of technology sped this process up. First, this GMP process development, good manufacturing practice, this was expedited because mRNA vaccines are less complex to make than other vaccine types. And like I mentioned, those lipid carriers and salts and sugars are already being used in other development processes, so they were available to use. Second, because the burden of disease is so high and we have so many cases of COVID-19, trials were able to meet their interim checkpoints a lot quicker than usual. Also, these trials were performed on a global level, so not just in one area. They were pulling patients from all over. Third, because this is a pandemic and the need is so great and urgent, these licensure agencies moved all of their efforts towards these vaccine productions. They moved them to the top of the to-do list, so they set other things to the side to focus on this. And then fourth, these mRNA vaccines are actually very easy to scale up for mass production compared to other vaccine types. So this step could also be expedited. And then lastly, companies had little monetary risk with the development of these vaccines as the government provided the financial support. So part of Operation Warp Speed was that the Department of Health and Human Services provided millions of dollars to these companies to expedite these trials and this development. So readily available funds meant that we could do multiple steps simultaneously, allowing us to speed up this whole process. So collectively, all of these are reasons why we have a vaccine so quickly, not because any corners were cut. The next myth that I've heard of is that these vaccines aren't as effective as other vaccines. Well, what does effective mean, and how do we test this? So efficacy is defined as the percentage reduction of disease in a vaccinated group of people compared to an unvaccinated group of people. And the way we measure this is by immunizing large groups of people with either the vaccine, here in red, or a placebo in blue. And a placebo is just a harmless fake immunization. Some people will call it salt water or sugar water. And then we monitor over time to see if anyone gets sick. And then we record the number of cases that occurs in each group. So we have case rate over here on the y-axis. And then the number of cases or incidents in the placebo group compared to the vaccinated group tells us how effective the vaccine is. And if we have a low incidence in this vaccine group, that means that the vaccine protects us from disease. So let's look at the trial results. Over here on the left, we have Pfizer, and then on the right, we have Moderna. And you can see that in both trials, vaccination prevented COVID-19 case rate more than placebo treatment did. And this is seen by these low level of cases in the vaccinated groups for both trials. And then importantly, there were similar numbers of cases in both the vaccinated Pfizer group and the vaccinated Moderna group, suggesting that these vaccines are similarly and highly effective. Neither is better than the other. They're both great vaccines. So how do these vaccine results compare to other vaccine trials? When we compare to two other vaccine trials, the shingles vaccine trial that was run by GlaxoSmithKline, and then the Prevnar pneumococcal vaccine trial, which was also run by Pfizer, we actually find that there are very few differences between the trials with respect to number of enrollees and efficacy. You can see that all four trials had enrolled tens of thousands of individuals. So some trials are not enrolling 100 people versus 100,000 people. They're all within the same area. And then also you can see that the efficacy was on par with the shingles vaccine. 95% for Pfizer, 94.1% for Moderna, and 97% for shingles vaccine. And actually, these vaccines for SARS-CoV-2 are even more effective than the Prevnar pneumococcal vaccine. And I highlight this because this Prevnar pneumococcal vaccine is actually licensed for use and being actively used. So we have better efficacy than current vaccines that are already in use. And lastly, some people are saying, how can you tell if something is effective when you have such low numbers of cases, right? If you enrolled 43,000 people, but you only have 162 cases of disease, how can you tell it's effective? But this is standard practice across all trials. You can see here, 210, 90. These numbers are all on par. So these trials were run with the same integrity, and you get the similar efficacy as other trials. So no difference there between those trials. There we go. Oh, too far, sorry. So another rumor is that these vaccines are not safe to take. And this is also false. The FDA and independent safety monitoring teams found that these vaccines are in fact very safe to take, and the benefits of the vaccine outweigh the risk of not being vaccinated. And there were no vaccine-related deaths, and serious adverse events were extremely rare in both trials. In fact, you have a higher risk of dying in a car crash on a daily basis than you do of having a severe reaction to the vaccine. So reports of a few allergic reactions to the vaccines in the past week have caused people to think that the vaccines are not safe for people with allergies. However, allergic reactions to vaccines are not standard or expected, and the normal rate of somebody having an allergic reaction to a vaccine is 1 in a million. Also, allergies are highly specific. For instance, people who are allergic to pineapple, that's the one thing they're allergic to, and it's very specific. So if you are allergic to the few ingredients that are in the vaccine, then of course you shouldn't take it. but you probably know if you are allergic to those specific ingredients because allergies are so specific. And then when you arrive to get your vaccine, you're going to fill out a screening questionnaire like you see on the right over here. And this is going to be done with your healthcare provider to determine if you are at risk for an allergic reaction. And if you are, then you won't be given the vaccine. And then everybody who gets the vaccine has to wait for 15 minutes. And this is because allergic reactions happen almost instantaneously. So we want you to be in a healthcare setting if you are going to have a reaction so that you can get the treatment, which is normally, I know a lot of you have probably heard of epinephrine or the use of an EpiPen and then Benadryl to manage that severe anaphylactic shock. And then lastly, doctors pretty much agree that if you have common mild allergies, there's no reason to not get the vaccine. You should be A-okay to get it. And then lastly, there's a rumor going around that these vaccines cause infertility, and I actually struggled to find out where this rumor came from because it was so vague. And it's a completely baseless blog post where somebody suggested that the SARS-CoV-2 spike protein was similar enough to your placental proteins that your immune system would then attack your placenta and cause infertility. However, these proteins are less than 20% similar, and a neonatal immunologist suggested that it would be like confusing a rhinoceros for a jaguar because they were wearing the same collar. So it just goes to show you how bizarre of a statement this was, and we actually have no evidence to suggest that these vaccines would cause infertility, and other vaccines do not cause infertility as well. And then just kind of a mind game would be the vaccine induces antibodies against the spike protein. Well, when you naturally get infected by SARS-CoV-2, you also make antibodies to the SARS-CoV-2 spike protein. So that would imply that all of the women in the world who have now had COVID-19 would now be infertile. And if that was the case, I assure you we would have heard about that. So that is definitely a myth. So that's not to say that you won't have some side effects after the vaccine. So I just wanted to touch on maybe what you can expect after you get the vaccine for the following 2 to 3 days. The top 5 side effects that were experienced by individuals in both trials were arm pain, headaches, fatigue, chills, and muscle pain. But let's go through these. So as you can see, most people, roughly 80% of all individuals, reported mild to moderate arm pain after receiving the vaccine, and this went away by roughly 3 days afterwards. Less than half the people who received the vaccine reported a headache, most of them mild in nature. Again, less than half the people receiving the vaccine reported some fatigue, both mild to moderate. Again, so 1 in 2 people will feel tired after the vaccine. And then most people did not report having any chills, but for those that did, the majority of them said they had mild chills for a couple of days post-vaccination. And then lastly, muscle pain was reported in about 21% of the individuals who received the vaccine. So I think the important thing to know is that these are actually all common side effects of vaccination, very similar to a flu vaccine, and can be handled with Tylenol. When I got my flu vaccine earlier this year, I actually made a comment to one of my friends saying, wow, this one hurt more this year than last year. And my arm was definitely in pain for a couple of days. But again, these are common for most vaccinations. And then just a couple more notes is that they reported that the people who were older, over the age of 55, reported less pain than those individuals in the 16 to 55-year-old groups. And then some of these side effects were a little more pronounced after the second dose. And that's because your immune system is doing its job. It's recognizing the vaccine much quicker, and so it's responding. So that's a good thing. And this kind of ties into the next myth is that people are saying, well, why do I need to take both doses? I should just take 1 dose. I only take 1 dose of the flu vaccine. Well, unfortunately, we have to take both doses for these vaccines. And the reason is we need them both so we can build that really robust immune memory to SARS-CoV-2 and prevent disease. And so I just wanted to touch on a couple things about the 2 doses. The doses are 3 to 4 weeks apart. So just have your calendar handy when you go get your first dose so you can mark when you're going to get your second one, depending on if you have Pfizer or Moderna. Pfizer is 28 days and Pfizer is 21 days and Moderna is 28 days. Next, both of these doses need to be from the same company. If you got Moderna for dose 1, you need to get Moderna for dose 2. You can't mix and match. And then when you get your first dose, they're going to give you a COVID-19 vaccination record card. And this is great because it allows you to keep track of which dose you got. And I know a lot of people are taking pictures of these, so they have them on their phone so they know exactly which dose they have. So when they go back to the next one, they can get the same thing. And then, like I mentioned above, the side effects may be a little bit worse after your second dose, but that just means that your immune memory is working. So both doses, not just one. And then I think the last myth is that as soon as you're vaccinated, you can take your mask off. Unfortunately, I know we all want to take our masks off, but this is not the case. We can't take our masks off until a lot more people are vaccinated. We essentially have to reach a level of herd immunity. So in the US, that means 210 million people need to be vaccinated. So I wanted to look a little bit closer at the concept of herd immunity. I'm sure you've heard the term around a lot, and I think this image really helps to understand it. So if you look here on the top left panel, the people in blue, they have no immunity, so they have never been infected by SARS-CoV-2 before. And then if there are people who have SARS-CoV-2 infections, the disease spreads throughout the population relatively quickly, which is what we're seeing now. In the middle panel here, you have a similar situation, but you have a few yellow individuals, and these yellow individuals are immunized. So they have seen the SARS-CoV-2 virus before and probably had COVID-19. So we say that they're immunized and have immunity. However, there aren't enough people in the population with immunity such that when you have two infected individuals come into the population, they get all of the blue people sick. And so we still have spread of the disease. But in this last panel down here, you see that most of the population has immunity to SARS-CoV-2. And so when these sick individuals come in, they can't transmit to any new unimmunized people. And so we are able to stop the spread of disease. So it's this last panel here that is herd immunity. And experts have identified for this virus specifically, based on its R0, which I think Dr. Powderly talked to you about, we need to reach 70% of the population to have immunity before we will achieve this situation and stop the spread of disease. So how do we get from here, where we're at now, where people are still getting sick, to herd immunity? We have two options. We can let natural immunity run its course, but this is going to result in an estimated 3 to 5 million more deaths from COVID-19. That's 100 times the amount of deaths that have already occurred in the United States. And this is just US numbers. I don't even know what the global scale would be. Alternatively, we can vaccinate everyone, and this would save many, 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 many lives. So until we reach herd immunity, where the rest of the population is protected, we need to keep practicing these 3 Ws, even though we're slowly getting everybody vaccinated. We need to wash our hands, watch our distance and stay 6 feet apart, and wear our masks. And the reason is because while vaccination keeps you from getting sick, personally, it doesn't mean that you can't harbor the virus and spread it to other unvaccinated individuals, like in that middle panel that I showed you. So I think I wanted to end with this thought. Currently, we are all here, masked up, physically isolated and distanced and surrounded by virus. And we really want to get back to quote unquote normal, whatever your normal is, if it's family gatherings, going to sporting events, going out into the bar and having a beer and celebrating. And the only way we get there is through herd immunity. That's how we're going to get there. And we have 2 options. We can let natural immunity take its course, like I mentioned. This is estimated. We have no clue how long this could take. It could take years. And again, the cost of 3 to 5 million more lives. Or we can vaccinate everybody. And this is really the safest and fastest. And if we all get on board and do it, we get back to quote unquote normal quicker. So with that, I'd like to say thank you, and I'd be happy to answer any questions.
Read these ones out. So Ken Zeller. question from Ken Zellers. What's the difference between the first and second dose? And then does the first dose provide any protection against infection?
Yeah, actually, let me see if I can get my slides back up. Actually, Rob, could you pull up the slides if it's easy for you?
Mm-hmm.
Thank you. It has to do with the way that your immune memory works. And the first dose is kind of like the training set. Can you go down a few slides for me? Keep going, I think, keep going. Slide number 46, please. Thank you. So if you see here where it says first infection and repeat infection, so the first dose that you get is the one that says, hello, immune system, this is the infectious material. This is what we're looking at. And your body makes a nice immune response, and you normally clear the virus. And I say normally, that's how infection is supposed to go. Your body's supposed to get it under control immunologically, and then you keep going along with life. However, if you get infected again, what happens is that your immune system goes, oh, hey, we've seen this before. Let's go after it and let's make an even better response. And what you're doing is you're honing your memory. So every time you see a specific type of virus or bacteria, your immune system remembers it and it gets better and it makes better antibodies. And then it helps clear the virus or the bacteria every time faster and faster. So in the case of the SARS-CoV-2 vaccines, a lot of us still haven't been infected. And even for those of us who have, the first vaccine is still great because for those of us who haven't been infected, it's going to educate our immune system and tell them what to be prepared for. And then we're going to do what's called this boosting when we get that second dose. For people who already have been infected, that first dose is going to act like a booster. And then that second dose is going to act like another booster. So they're going to be even more farther ahead in the immune memory honing, if that makes sense.
Awesome. Thanks very much for that question. We had also one from our colleagues in mental health about, Binax Now or some of the antigen testing. If someone gets vaccinated, can they get detected by some of the tests like Binax Now or some of the antigen tests and come back positive after a vaccine?
That's a really good question. I don't know the Binax Now rapid antigen test specificity. That one is based on protein, not on nucleic acid? I would say in that case, the mRNA vaccine, it makes those proteins, and then those proteins are going to be very quickly taken up by your immune system. So if you were to potentially test somebody in that really tiny window, and the Binax Now test does detect spike protein, then you may get a false positive, if you will. But otherwise, I would say, no, you shouldn't have an issue with that. But I would have to actually get a really concrete answer for you on that. I can look it up and get back to you. It's a good question.
Awesome. Thank you very much. We have from Patrick McKenna, if we're trying to manage particular facilities, is there a percentage of employees at a particular facility that, that would enable safe removal of social distancing measures to normalize workflow in terms of like percentage of vaccination? Imagine if you have a facility with 100 people in it, and let's imagine that, where would things get where you could start to remove those restrictions?
I think the estimated 70% that scientists are suggesting right now off of this, I would have to definitely check the modeling on that, though, for sure. But right now, Mayo Clinic is suggesting that 70% of the population. So whether you're in the entire country or where you're at, it's based off of the R0 and the virulence of that virus. So collectively, I think that 70% of the employees, if I was making an educated guess, would have to be vaccinated or have immunity to go ahead and start altering your workflows.
Awesome. Thanks very much. Do you have a perspective? This comes from our Department of Elementary and Secondary Education. do you know what the status is on the trials for children, since they're not included in the first
Yeah.
wave?
Yeah, so I'll remember it correctly, hopefully. But Pfizer actually started their trials at the end of October, enrolling between the ages of 12 and 17 in their children's trial. And then Moderna is actually slated to start their trial for that same age group. I think by the end of this month, but they haven't given any indication that they're actually starting on that. Right then. They may be pushing it back a little bit more. But the way that this is probably going to work is that first, we're going to do the 12 and 17-year-olds and get safety and efficacy there. And then it will roll down into probably like 12 to 5-year-olds. So because children have really potent immune systems, we want to slowly stepwise it down and make sure that they don't, have any adverse effects to the reaction. But yeah.
Awesome. Thanks very much. And I think someone could go on mute. There's some background in there, but from Ann Priestley from a Department of Corrections, a great question, which I know is on people's mind. If someone's been positive, should they still get vaccinated?
Yeah, so I think this kind of touched a little bit on before, but yeah, you should, definitely. And the CDC is also saying to go ahead and do that. And the reason is because you saw the infection once, so your immune system is out there patrolling and they know what's there. But then this vaccine is going to go ahead and say, hey, let's make you even stronger and even better. And so having that vaccination is then just going to hone the memory that you've already made. So it's a good idea to go ahead and get vaccinated.
Awesome. And a question of, do you have the current perspectives on, how long the current injections or vaccinations will be effective? What's the duration of the immunity?
Durable immunity. This is a good question. So these trials are set up to have a 2-year follow period. So we'll be assessing immune efficacy and durability of immunity out to 2 years. Right now, there's no indication that this should wane anytime soon, but we just don't have the data on that. If we talk about from our lab-based models, so in mice, we see that they are maintaining immunity to these vaccines for a long period of time. So again, we just don't have the data yet, but all indications and concepts would suggest that we will be able to have some relatively long-lasting immunity. It might not be quite like our measles vaccines that we get as a child and then we're protected for forever, but we should have some immunity for a while.
Awesome. No, there's been some, and this comes from Anna Hugh in our Department of Labor and Industrial Relations. There's that recent news about potential mutation of the virus in the UK. Does that affect the efficacy of the current vaccines?
No. Right now, based on where these mutations are and the modeling that they have been doing, they don't feel that that this virus will evade the vaccine. So the vaccine will still be effective for this new strain. They don't anticipate it being an issue.
Awesome, thank you so much. I'm going to come back to a more technical one from Katie Jo Wheeler, but I wanted to answer from Nathan. Yes, we are recording this session, and the intent is that we'd be able to distribute this to the workforce in the new year. But we'll be able to make it available to staff to be able to see. So thanks very much, Nathan, for highlighting that. Katie Jo Wheeler from our Department of Natural Resources. Let me see if, I'm going to ask actually Katie Jo, why don't you come on and voice your question, because it's a few lines here and it's probably better for you to do it than for me to try and synthesize it.
Sure. I'm getting questions from folks about the particulars of if I've had the virus or if I have had a vaccination, why do I still need to wear the mask personally, which is a slightly different question than the one you've already answered for us, Dr. Thomas. So I wondered if you could elaborate on this concept of I have my own immunity, but I may actually be able to harbor and transmit the virus to others.
Yeah. So you actually have put the finger right on the nose. So there's actually different kinds of immunity that can be induced, and one of them that we have is called sterilizing immunity. And this is the type of immunity where your body basically blocks anything from ever coming in and infecting you again. Like it just isn't going to infect you. However, that is very rare. Most of the time, what we get is something called protective immunity. And this is what this type of immunity that these vaccines, as well as COVID-19, is giving us. And this means that our immune system can recognize invaders and clear them, but those invaders can still have the opportunity to give you an infection. So you might not know it. You might have a low-level infection, and your immune system is clearing it out, but you're not feeling sick, because the vaccine has essentially made it so you don't have to get sick, right? You don't have to have the massive inflammation and coughing and everything, because your vaccine-mediated immunity basically created the immune response without having to do that. So while your body's getting rid of this invader, you could still have the virus in you. And when you go out and you breathe on somebody, you could potentially infect them even though you don't feel sick, right? So that is why we need to make sure we can't take our masks off, because even though you don't feel sick and your immune system, whether it's from natural immunity or vaccine-mediated immunity, is able to keep you from getting sick, you can still potentially have the virus in you, and then you can potentially infect other people. And if they're not vaccinated, if they're those blue people in the herd immunity infographic, then they're going to get sick. So it's kind of, yeah, it's great that you're not going to get sick now, but the reason we're doing this is also for our family and our friends and our community. So we're just, if we can wear our masks until enough people around us have immunity and are vaccinated, then that would be ideal, because then we can all take our masks off without worrying that we're going to infect somebody who's not vaccinated or who doesn't have immunity. Was that helpful at all?
That was exactly the information I've been looking for. Thank you.
Yeah, and I'm happy to talk more with you about herd immunity and give some better examples too, if that will help you move forward and explain that to people.
Thanks very much, Dr. Thomas. We have a couple others from Cindy Dixon in the Office of Administration. How many days after the second shot would a person have the full immunity or full impact of getting that second booster?
Yeah, so I'm glad we're still on this slide. So if you look on the bottom on the x-axis, you see that days after antigen exposure. You can see after the first infection, your immune system normally, what we say is peak working, peak doing its job, is between 7 and 10 days. That's when everybody's out there really, making lots of copies of things, honing in and making these antibodies really specific. So after the second shot, if we look, we can see probably about 3. So actually, this is a really good opportunity to do this. I'm going to say this. On your first infection, see how it takes 7 days to get to your peak? After your second infection, you're at your peak by 3 days. And this is what we call recall. Because your immune system has seen it, it can act faster. So it moves that peak of the response earlier. So based on this, after the second shot, you would be honing your immunity by day 3. And then we have what's called a contraction period. And so by 30 days after that second infection, you have really, really nice immunity that is hanging around and ready to go. But to be honest with you, by 7 days after this first shot, you're going to have immunity that will be able to respond to the SARS-CoV-2 virus. I hope that was helpful.
Awesome. We have a question from Carol Comer, Department of Natural Resources, which is, do you think that this is going to be something like an annual vaccine analogous to flu shots?
Yeah, Carol, it's a great question. We won't know that until we have a better idea on the durability of the immunity. If the durability of the immunity seems to only last for about a year, then yeah, we'll probably do an annual shot for everyone. But if we see that the durability lasts longer than a year, then we won't have to do shots annually. we might be able to extend them. Kind of like a tetanus shot, right? Your tetanus vaccine, you don't get that every year. You get that normally, I think, every 7 to 10 years is what they're saying right now. So some of them, depending on how long the immunity lasts and how long we follow up these trials for, so we can measure all of these things, that's what helps us dictate how often you have to get a vaccine.
Awesome. Thank you very much, Dr. Thomas. I'm going to open it up for the last opportunity for any more questions for Dr. Thomas. We've obviously gone through quite a few. The myth busting was fantastic, but are there any more questions from the team that you want to put in the chat function?
While everybody's typing, I just want to let you know that in the slide deck, after the thank you, there is additional information, and I've tried to put as much of the citations in there as I can for you to be able to go read more and find more information if you're interested. And if you have any questions that I can help clarify or point you in the direction to, I would be more than happy to.
Awesome. Huge thanks, Dr. Thomas, today for making the time. Fantastic presentation, extraordinarily clear. We have, actually, there's one last question coming in, which is the vaccine safe for pregnant women?
Yeah, Sarah, this is a really good question. And I know a lot of people have been really concerned, but as of right now, we are still doing the clinical trials with pregnant women as enrollees to be able to give you data saying, yes, it is safe and effective. So we don't have data to support the claim yet, but there is no evidence or information that would make us believe that it is unsafe for pregnant women to take the vaccine. So as of right now, I'll let you know that I have a friend who is pregnant, and I am answering questions for her, and she asked me if I was pregnant, would I take it? And I said, yes, I would take it. But again, we don't have data to tell you this is how safe it is, but all of the scientists and the clinicians feel that based off of what the vaccine is made of and the type of immune response that you're going to have, that there's no harm to you or your growing baby to have the vaccine.
We have one other question from mental health, which is, can breastfeeding women take the vaccine?
Yeah, again, great question. And right now, there is no reason to think that they can't. And I guess this is a good opportunity, these last two questions, to kind of reiterate. These mRNA vaccines are really cool because they don't contain any infectious virus. So there's nothing that you could pass on, like infection-wise, to your baby, either through your breast milk or as you're sorry, I always say incubating, as you're incubating your baby. So there's no infectious material like some of the other vaccines that are made from attenuated viruses. So these ones, it's just a little copy that makes a protein. So they have no evidence that would suggest that it would be bad or cause any problems. But again, we're getting the safety and efficacy data as the trials continue.
Awesome. Huge thanks, Dr. Thomas, for covering knocking down myths, but in doing so, really explaining the fundamentals here. I know immunology is a challenging field to communicate clearly, and you did a fantastic job, and just want to extend our personal thanks. Know that you spent a lot of time and energy to put this together for the cabinet and leadership team for the state of Missouri, and also letting us record this to share with others within the state government team. So huge thanks and appreciation. And we'll give you from the Fusion Cell headquarters, a round of applause. So that was awesome.
Thank you. No, I just want to say that this is a fantastic opportunity to share with you all, and I'm really honored that I was able to do this. So it's great practice for me too. I think one of the first things I told Drew is that sometimes as scientists, we don't do a very good job communicating. So thank you for taking the time and asking questions and being engaged. It's really great.